Can you see this guys
Yes,
correctly?
looks great.
Perfect. I have two monitors, so it's like sometimes it just it chooses a different one every time, I swear. But all right. So I just want to thank you guys for joining tonight. Yeah, Sandy called me maybe a month ago, a few weeks ago, and was like, what do you think about doing Lyme disease? Everybody's bringing it up. Everybody's talking about it. It's big right now because it's springtime. Everybody's getting outside, starting their gardens, right? And it's just a big topic right now. And it's something I'm very passionate about. I have a lot of personal experience. My mom went through a lot of things with Lyme disease, so it weighs heavy on me, and I want to share it. I want to educate people on these things. Just because it is a big deal. And I think a lot more people are probably dealing with Lyme than what we may think. Okay. And we'll get into some of those different things, but just really passionate about this. So happily willing to jump on here and help you guys out. If you guys have any questions too, again, I'll stay through the end and we can answer any of those things. If we don't get it covered tonight, you can always reach out to me, reach out to my office, and we can get questions answered for you, or if you need help, anything like that. But just want to talk about obviously Lyme disease today, and big thing like how to protect yourself. So what do you do? Have you gotten bitten? What's your next steps? Did you get diagnosed with Lyme disease in the past? Do you feel like it was properly treated? Do you not, right? Does it seem like it's coming back? So there's a lot of different things to kind of go along with this. Um, and we're going to cover those things today. I'm going to stick to some of the basics. It can get complicated in here. We'll keep it simple, but we can see there's a lot of really good resources and a lot of really good books out there. I literally like this is where I got so much information. You can see I right tabs everywhere. This was a vacation read for me. I'm a nerd, so literally took a week trip to Florida and I went through this entire book. This is my vacation read. So people think I'm crazy for that, but I love it. I love soaking up the information, everything that I can. So there's a lot of really good things out there. And traditional treatment is you go to the doctor, maybe they diagnose you. If you do, then you get put on an antibiotic, right? And that's it. Here's an antibiotic, you're good to go. Okay. There's so much more than that. I find that that does not work. Okay. It works temporarily, but it always seems to come back. There always seems to be other things. There might not be enough. It might be something else. So we need more than that. And there's a lot of natural people out there, and there's so many good natural things that we can start to do. One, to help support ourselves, but also two, help go after if you do actually have Lyme disease. So here's some really good resources to start to look at. Now, some of these are very complex, like medical textbooks. So they do get pretty heavy in there, but good ones to look at if you are interested. So when we talk about Lyme disease, we'll just briefly kind of touch on it. It got its name because the first case ever reported was in Lyme, Connecticut. And so that's where it got its name. Now, not to get too far into it, some people call it Lymes with an S. People get sensitive over that. I don't really care, right? It's just a name I know you're talking about, but it's not Limes with an S, it's Lyme. So if anybody gives you a hassle about that, that's why. It was discovered by a name called Willy Borgdorferi. So the technical fancy name for Lyme is Borrelia burgdorferi. Okay, so that's where that comes from. And really doing research and going back, we found the first case nearly 5,300 years ago. They found his name was they named him Otzi. They found a man frozen in a cave in the mountain, and turns out he had Lyme. Okay, and he was been frozen for a long year, so they dated him way back, long time ago. So Lyme has been around a really long time. We've been living with it. So okay. Borrelia burgdorferi. So what makes this one unique is it's something called a spirochete. Okay. So you can see that it spirals, kind of like a corkscrew. Okay. And that's what gives it a lot of its unique traits. Okay. That corkscrew, I think about it just like a wine opener, right? Twist down through that cork. With its shape and with that, it can bury into tissues deeper in tissues that other things can't, right? A bacteria is usually round, sometimes long and slender, kind of like a pill shape, but those can't normally bury into tissue and things like that where this one can, right? It can like corkscrew itself into different places that a normal one wouldn't. And this makes it really tricky. Okay. And there's actually quite a few different types of spirochetes. Syphilis, right? That's a big one that we know of. So these things, they can cause a lot of hassle, a lot of damage, right? Syphilis is not good. And there's a lot of different kinds. Now, going back even just to 2015, we're discovering there's a lot more cases. Okay, so even back in 2015, it's hard to say, like with this, they used to say there's about 20,000 cases per year in the United States. By 2015 they were saying 300,000 plus cases. It's a lot more than that. Okay, and we'll talk about it. The testing isn't very good for it, so we can get a lot of false negatives with these types of things. And this is honestly what happened to my mom. My mom got bit back in 1992 by a tick. She kept the tick. She got the classic bullseye rash. When she went into the doctor kind of blew it off and was like, nope. So she didn't get any sort of treatment, didn't get any sort of help with that. And then got kind of sick, kind of got better. And over the next 18 years, it would kind of flare up and go away, flare up bigger and go away. Okay. And I mean, I've seen my mom like each time it flared up, it got worse and worse and worse. And so going through high school, going through these different things, when I was born in 1992. So by the time I was in high school, we were already 13, 14 years into her actually having Lyme, and she was starting to get really sick. Okay. I remember when I was a freshman in college, she had been to several doctors. They had put her on several medications, all these different things. And basically, what I saw is each time they went somewhere, they couldn't find any answers, and they just gave her a handful of medications. And basically, they were closing their eyes, throwing a dart, and hoping to hit a bullseye. Okay. Um, and it never worked. I've seen her have severe reactions with medications because their doctors didn't do their job and didn't look at is there interactions between these. So I've seen her have like seizures. I've seen her have just like hysteria and like just not know where she is or not know what is going on around her just because of this interaction between medications. Even as a freshman in college, she ended up having to have the bottom part of her skull removed because her brain was so swollen. It was so infiltrated with Lyme and swollen that it was actually herniating out of the bottom of her skull. Okay. And so it wasn't, does she have a headache? It's how bad is her headache or what sort of migraine is she going to have today? Kind of thing. And so in order to relieve that, they literally moved part of the bottom of the skull, opened that up so there wasn't so much pressure. And again, they still didn't diagnose her with Lyme. I think if I talk back, I think they tried to test for Lyme almost a dozen times and she failed it every time, so they can never officially diagnose her. But it took 18 years and her finally going on a medical leave. She really had to leave work because she couldn't concentrate, had such bad headaches. Her memory was so bad. She ended up finding somebody in New York who was a Lyme specialist and officially diagnosed her. And that's when she started her process of recovering. Since she got that diagnosis, she was allowed to get proper treatment and start to kind of kill off that Lyme with some antibiotic cycles and different things like that. And I'll get a little bit more in depth of what that looked like when we get to that section. But that's what I've seen. So I've seen like the worst of untreated or undiagnosed Lyme. And that's why I'm really passionate about it, because I don't want to see that for everybody else. If you get Lyme, if you come in contact with a tick, you want to get on top of it really quickly. And that's why it's like I feel like so many people are sick and there's so many different issues because we don't get that proper diagnosis like we see here, right? It keeps going up every year because things do get better, but it's still poor. And it's tricky, right? Because it's one of the most advanced single cell organisms. They really thought about reclassifying it as its own group because it's so advanced, it's so smart. It's parasitic in nature. It alters its structure. It it splits where one becomes two very, very quickly. It's very mobile. It's very fast. It's faster than your own immune cells. Your immune cells, the fastest one is a neutrophil. It's twice as fast as that. Okay. Think this guy's on a crotch rocket and we can even have the best police cars in our body. He's still getting away. All right. So we got to be strong. We got to do the right thing. And a lot of times it comes with co-infections. There's really two types of Lyme disease, okay? There's active Lyme disease. This is where you have it in your body, it's causing havoc, it's causing pain, it's causing all these different diseases and symptoms. This can be acute, I just got bit and these flared up, or I got bit 18 years ago and it's still giving me problems, right? Or chronic. That can come from the patient not being treated or an unsuccessful treatment, which I see very, very often, okay? And Lyme can still persist and causing further damage to these symptoms, right? So they bury into tissue, you do get antibiotics, the antibiotics doesn't get all the way to it and doesn't kill it. Well, now once you're done with those antibiotics, those some that are left can still replicate, grow, spread, and continue to cause some of those damage. A lot of times too, they miss co-infections that can come with it, and those don't properly get treated. Then we have what's called post-Lyme disease syndrome. So this is where, let's say you had Lyme and you were successfully treated, but then the damage is never repaired. Okay. I always say this is your body's kind of like a house. Lyme disease is a giant fire. Okay. Step one, put the fire out, right? You got to do that. But if the fire took out your kitchen, took out your bathrooms, took out your bedroom, you still don't have a livable house. There's more steps to this process. So you got to support your body. You got to rebuild the body back up so it's to a good, healthy place. If all you do is put out the fire, the house is still burnt down. So you got to go a little bit deeper than that. Okay. So what can carry Lyme, right? We all know ticks. That is the most common kind, deer tick being the most common of those different ticks. But you can get it from other places, just not nearly as common, like mosquitoes, mites, fleas, flies, those different things like that. So you can get them from that. And let's say like a mosquito, the way you're going to get that is, let's say I have Lyme, a mosquito bites me, Lyme transfers to the mosquito and then goes and bites somebody else, it can transfer it, okay? But most commonly, you're going to get it from that tick, okay? And we can see on here, there are some shows us different stages, right? Larvae is the little babies, nymphs are like the teenagers, and then there's adults. We used to think that only adults could give us Lyme, but really any of them can, okay? Mother who has Lyme lays eggs. Oops. Mother who has Lyme lays eggs. Well, there's a chance that those babies can just be born carrying the Lyme. Okay. So there's always that. Just as part of that. But each of these, right, a Lone Star tick can carry it, but they're more commonly going to carry things like Rocky Mountain spotted fever. The dog tick, they're going to also Rocky Mountain spotted fever, but also like tularemia. So again, maybe you got bit by a tick and you test negative for Lyme. Maybe it's not Lyme, maybe it's something else. This is why you got to do complete testing as well. And that's one thing that I see lacking. Okay. I'll show you and you'll see it in just a little bit, but when I test for Lyme, I test for Lyme and 11 of its most common co-infections, like the Rocky Mountain spotted fever, like tularemia, like Bartonella, like plasmosis, and I'll show you some examples of that. Okay, so what can Lyme look like? It can look like so many different things. Everybody's different. And what I'll say is it'll usually go to your weak spot first. Okay. If you have a damaged knee, if you've had knee surgery before, right, something like that, you're probably going to feel it in that there before you feel it anywhere else. Okay. Or you're going to feel it closest to the site of injection. Okay. I mean, but you can get fatigue, heart problems, joint problems, nausea, vomiting, inflammation, especially in the eye, weakness in the limbs, Bell's palsy, meningitis, bullseye rashes, flu-like symptoms. You can get rashes across your body. You can get a stiff neck, headache, fatigue, fever, chills, liver issues. There's a number of different things that can start to happen, okay? We know the classics. The classics are going to be a bullseye rash or some other rashes. Classics are going to be joint pain. We can start to get headaches. We can start to get flu-like symptoms after a bite. We can start to feel fatigued. You feel this a lot in our chronic cases. So again, there's a number of different things that can start to happen, but guess what? I mean, this also looks like the flu, right? Well, you can get rashes from a lot of different things. So that's where it can get confused. And it's like, well, it might just be I have a cold or a flu. Could be, but it could also be Lyme. So there's a number of different things to consider. Why it likes so many of these different places, especially like something like the eye, like your joint, like your skin, okay, is it loves collagen, okay? Collagen is one of its favorite food sources, so it's going to seek that out. That's why you get a bullseye rash, because the collagen is connective tissue. It holds your skin together. So when you get a bite, it's literally starting to eat away the collagen around that site, and then you start to get this little bullseye rash spreading out around there. That's why it loves joints. Your joints are full of collagen. Okay, so it goes to those joints and it starts to wreak havoc around there. Your brain and your nervous system are full of collagen, digestive tract, connective tissue, right? Leaky gut. If we don't want leaky gut, we have to have strong collagen, strong connective tissue to keep that gut nice and strong. And your eyes are collagen to hold everything together. This is where I have a lot of patients, especially with Lyme, they have floaters. They can see things floating through their vision, but it's really in their eye. This could be Lyme. It could be the Lyme literally floating through that eyeball and through trying to get to the collagen. In there, right, the example, this is actually a scan of my mom's neck and my mom's brain. And you can really start to see where the Lyme literally started eating holes in through some of these different things. Okay. So, I mean, she has, right, that's going to give her a headache. That's going to give you a migraine, especially, but memory loss, clarity issues, all sorts of different things that she's struggling with. Oops, things have gotten a lot better today after getting diagnosed in 2010 and going through her treatments. But then also after I learned everything, we basically finished hers. We went back and did a more natural approach, and she saw really, really good improvement after that. Okay. But I can't regrow brain, right? So we still deal with some of these different things, like memory and whatnot. It attacked her joints. This is her neck as well. So we can see a couple of healthy discs, but the rest of it is really starting to be eaten away, dealing with arthritis, neck pain, things like that, right? I can't grow back discs and everything, but this is kind of that aftermath of seeing some of that. So there's other conditions associated with this. And again, it comes down to a lot of this is that post-treatment. So if we don't repair the body or we don't properly treat the Lyme, this is the aftermath of it. So there's something called morgellons, okay? It's going to attack the connective tissue. You can start literally getting these crazy filaments coming out of your skin, literally like string coming out of your skin. Very rare, but happens with chronic Lyme disease once it starts to do enough damage. I mean, see it in autism, Alzheimer's, Parkinson's, dementia. What do all those have in common, right? Your brain and nervous system function. Well, if Lyme gets in there, starts to destroy stuff and things don't work properly, you can really start to get some of these things, okay? You can start to have autoimmune reactions. Lyme bombards your immune system. Your immune system is your natural defense, your little army, right? Well, Lyme gets in your body, your immune system's going to try to attack it, right? It's trying to defend itself the best it can, but Lyme is so darn tricky and it's so darn smart and it likes to bury itself into places and hide that sometimes we can't catch it and we can't get it all ourselves, right? That's how we need to help it along. But when we get chronic Lyme, we can start to get autoimmune conditions, okay? For example, let's say Lyme gets through your body, goes to one of your joints, okay, because it loves joints and your body finds it. Well, now your body's got to sacrifice some tissue to go after that Lyme. This is called an autoimmune, right? Your immune system attacking itself. But why is it doing it? I see I'm finding more and more all the rheumatoid arthritis patients that come to me, a vast majority of them actually are dealing with Lyme that wasn't properly treated or was untreated or misdiagnosed or undiagnosed, right? They basically have Lyme and the Lyme is deteriorating their joints, it's causing inflammation. Well, the immune system is trying to attack it, so we have autoimmune markers in there, but it's just this battle that can't ever be won. So rheumatoid arthritis is a big one that I see with that Lyme. Pandas, this is kind of a same thing as like Alzheimer's, Parkinson's, dementia, but more in kids. So again, just that affecting, right, neuropsychiatric. So the Lyme causing autoimmune parts of things, but especially with our neurology and how our brain is communicating. And this can affect also our psyche and our mood and different things like that. So just associated things that come with it. Why it can get tricky as well as one thing it likes to do is it likes to create what's called a biofilm. Okay. So I always imagine it like you have a castle. Well, you build a castle, you build the walls strong, you close the door and nobody can get in. That's a biofilm, right? So they're protected in there, they're in there, whether you're taking antibiotics and different things, you got to do the right thing to even penetrate it and get in there. So they're securing themselves. They don't want to be killed. So they're just going to defend themselves in this way. And we'll talk about this in a little bit, what you do about this. There are things called biofilm busters that can start to break through these to allow you to actually get to this. But this is another way that they can kind of go undetected because while they're all kind of in their castle, well, maybe they're not in your joint, maybe they're not somewhere else, but okay, they're hiding for a little bit until they like to come out. Or this is where you can get kind of like relapsing. It comes and goes, comes and goes. If one of these, if everybody's in a biofilm and they're not causing symptoms and inflammation and damage, but then that biofilm bursts for whatever reason, now you get a whole bunch of now you get a flare up and you get a whole bunch of symptoms. And then they get dealt with or they recreate a biofilm and now it tones down for a bit. So we can see that as well. And then we have, this is probably the biggest thing I see. Okay, it's what's called an encysted form, also known as a round body. This is their defense mode. I think about it like a little turtle curling up into its shell. Okay, this is probably the number one. If you know anything about Lyme, this is probably the one thing, one of the most important things to know is that there is active Lyme and then there is inactive. This is the inactive. It goes dormant, it goes into defense mode and sits there, and antibiotics can't get to it, natural things can't get to it. Well, they can somewhat, we'll talk about that later, but it kind of just goes into defense mode and then it is really hard to get to. And they've shown, research has shown that they can sit in this form for 36 months and then reactivate. Okay, 3 years, right? So, well, I take my antibiotics and I felt better for 2.5 years, and all of a sudden, oh, I don't feel good again. Well, we treated your Lyme, so it's not Lyme. Could be, right? It could be, it just took them 36 months to reactivate and get there. Okay, so we do see co-infections that come with it, and this is also what I see missed a lot, is that they only test for Lyme. And we'll talk about the Lyme testing isn't great itself, but they don't test for these other things. Chlamydia is one of the number one things that we see with it. We also see Borrelia or other Borrelia organisms, babesiosis. We also see, this is what my mom had as well. She had Lyme and babesiosis. We have Bartonella, which is basically cat scratch fever, Bartonella henselae, cat scratch fever. We have Rocky Mountain spotted fever, Colorado tick fever, tick-borne relapsing fever, and tularemia. Okay, so these can all come in a tick or those other carriers. You can get Lyme, you can get a couple of these, right? It's maybe not just Lyme. You might not get Lyme, but you might get Bartonella. Okay, there's several of them, right? So getting this complete picture is going to be really important. Okay, so how does this happen? How does this initial infection happen? Biggest thing is you get bit, right? We know that. Again, whether it's a tick, which is going to be the most common, might be a mosquito, flea, something like that. Okay, then basically it's going to transfer over from through the blood, through its saliva, gets into the bloodstream, through basically it'll hold it in its midgut and kind of go through that. The biggest thing to look for is a bullseye rash, okay? Bullseye rash is 100% confirmatory sign that you got Lyme, okay? If you have that, you contracted Lyme. That's 100%. The unfortunate thing is this only happens about 30% of the time, okay? And it happens within the first 2 to 7 days. So the first week, you're going to get that bullseye rash if you get it. Just because you don't get it doesn't mean that you didn't contract Lyme, because again, 70% of the time you're not going to get it, even if you contracted it. So that's what to kind of look for. If you get bit, keep an eye out for that bullseye rash, and go from there. If you get it, you have it. We'll talk about what those next steps are. That's what you're kind of looking for, right? Can't miss it. Big bullseye rash. Second part of this is that transmission. The old thought used to be is that the tick had to be attached for you at least 24 hours to 48 hours. That is not true, okay? It can be far less than that. It can be as little as 10 minutes, okay? Now, the average is going to be 4 to 12 hours for it to contract because it takes time. It crawls, it latches on, right? Maybe it just barely attaches yet. It doesn't really get its head in there and really kind of get deep. But there's a lot of factors that play into that. But now we're seeing, again, closer to that 4 to 12 hours. But factors that can decrease that is your overall health. If you have already some other conditions, that's going to affect the transmission time, making essentially you weaker. If you're on medications, if you're not healthy, if you have all this other stuff on, if you're already immunosuppressed, well, that can happen a lot quicker. Another one is if you get bit multiple times, okay? Or again, you get co-infections. If you have some other infection going on, that can have a big impact. There's a difference between hard and soft ticks. Okay, hard ones are just like you see in that picture. Soft ticks are going to be like gray and actually squishy. Like if you find one and you pull it off, I pull them off my dog all the time. Pull them off and like, yep, they're soft and squishy. These ones, like you can hardly even squish with your fingers if you try. What I always recommend is like any tick that you pull off, put it between tape. Especially if you pull it off yourself, make sure you're getting that head, and we'll talk about that in a second. Get a piece of like Scotch tape or some sort of tape and stick it to it, put it between, and boom, and then make sure you seal it around it, okay? It can't get out, it can't move, it'll suffocate, but then you have it, okay? And what I'll say too, and we'll get to that part, I mentioned my dog having lots of ticks on it. Again, a lot of us have pets. It's inevitable at that point. A lot of these things you can also do for your animals. I do a lot of stuff for my dog. This time of year, I'm constantly giving her stuff, putting it in her food to help her. So, but as things progress, right? Let's say we did get a bullseye rash, something happened like that, that Lyme infection starts to spread through the rest of your body, through your blood and lymph, okay? You can get additional rashes. Rashes can start to pop up other places in your body. Typically, you only get the bullseye rash at the site of the bite, but you can get them other places, but you can get other rashes that are like light pink to gray in color. They're going to be like consistent in size with each other. And that can happen anywhere from basically the first 6 months that you start to see. Again, that's just it spreading, and it likes that skin collagen tissue. Okay, again, the tissue of choice is skin, your joints, and your nervous system. So look out for those type reactions. Just had a patient literally yesterday morning, did some labs, did some different things, and I was like, something's just not adding up here. Is there any chance that you've been bit by a tick or had Lyme in the past? And he was like, yep. He's like, yep, I got bit last November and got bit, found the tick on my hip and pulled him out. And literally by the end of the day, like, was getting dizzy and lightheaded and had a headache, and his whole left side of his body like ached. And I'm like, yep, there we go. All of his joints, shoulders, everything started to ache. So we start to see those things, and again, especially correlating that to right after that. Treatments, especially once in these infections the Lyme has progressed, are going to be longer, more aggressive, and there's less chance for success. You want to get on top of this as soon as possible, okay? The more it replicates, the more it spreads, the harder it is to get to it. So act quick, and act strong. Okay. That's where I tell people, if you ever get bit by a tick and you have a question, call me like today, right? Call me the day that you find it, because we can make a plan and we can get on top of it. We can get on top of it quick. If you get a bullseye rash, call me, go somewhere, go to the doctor, right? Start to get treated, because the sooner you can do it, the better. I owe it. This is one of, and we'll get it to it, but this is one of the few times that I do recommend probably a antibiotic, but you also need a natural approach because they're usually not enough. And again, you need to do the rebuilding process afterwards. So you want to act fast when something like this happens. Again, diagnosis criteria, that bullseye rash is the only 100% confirmatory, but we only see it 30% of the time. The testing is these two tests, ELISA and Western blot. They look crazy, right? So that's for us to kind of know. And one of the criteria that they use is location. This is very old thinking. So do not go off of this. They used to just think if it's certain areas, then only the people that live in those certain areas can get it, right? For example, us up here in the Midwest, it is like the black hole. It is everywhere. It is very strong, very potent here. So they'd be like, yep, could be, but if you lived in Florida, you're okay. Not necessarily true, right? Because if here we look at the map, we're in Wisconsin, it's the darkest green, right? But if we go to Oklahoma, no cases, doubt it, right? Not sure I believe that one. So, or New Mexico has 7 cases. Bet it's more than that, right? So they base it off of, well, you live in New Mexico, you got bit by a tick, yeah, you don't have Lyme. That's a shot in the dark, okay? I'm not trying to guess at my health. I would rather get the correct information. I don't know why it keeps doing that. Here's that Western blot test. It's hard to read in the first place. Find somebody to read it, but the hard part about it is it's actually really inaccurate, which is sad, and it's always been that way. It's gotten better throughout the years, but this is why my mom went misdiagnosed a dozen times, because even though she had Lyme, she failed it a dozen times. It's only about 60% accurate in the population that was confirmed to have it. So they confirmed 89 people in this study, 89 people clinically had Lyme. They retested them with these tests, and they showed that it only had about a 60% accuracy. So in 40% of the people, just false negatives over and over again. So it's not very accurate. So just because you fail a test that doesn't mean that you don't have Lyme. Does that make sense, right? You still could have Lyme even if you technically failed the test. And there's really 2 approaches to this, okay? And really both of them are the ones that we want to do, but the one on the right is the one that we tend to ignore the most, okay? And it's, do we weaken or kill the invader, or do we strengthen the host? And the answer is best. And the answer is both, right? But which do you have more control over, right? I have more control over what I do versus the tick, right? It's just, it comes down to, I want to say luck. There's definitely things that we can do, but by us, like, it's inevitable that a tick's going to get on you at some point in time. Hopefully it doesn't bite you. Hopefully you find it before then, but there are things that you can do. But guess what? In the meantime, the stronger you make yourself, the better chance that you have in the long run for all of this, okay? So you don't want to be the weak link in this situation, and that's what we're going to talk about. Okay, so what can you start to do? All right, well, when you're going outside, you can use some different insect repellent, and we'll talk about that in a second. Wear white clothes because they're usually black so that you can see them, especially if they're little tiny larvae, they're little black specks, right? And you wouldn't see it if you're wearing a black shirt. So you want to try to wear lighter clothing so that you can see them. Sometimes you can, but avoid area of high grass. Hard sometimes. Around here, not going to happen. Wear long sleeve, a lot harder for them to get to areas. If they land on your shirt here, right? If they land here, they're just on your shirt versus boom, now they're right on your skin and can crawl other places. So long shirt, long pants, socks, tuck, I know it might look weird, but tuck your pants into your socks, right? So there's no skin showing if you can. Now I know, right? It gets 95 degrees and humid here, and I'm not going to suit fully up, but Again, do the best you can in that situation with those things. Okay, so what can you do, right? You talked about using bug repellent. Well, TerraShield is wonderful. I use this a lot, spray it especially around like on my boots and on my different things. If I am going out, I try to spray it around the bottom. I spray this on my dog as well. We actually have a collar that you can put essential oils on, and we put this on the collar, and so it has a strong scent and tries to repel them because the little ticks are standing on the grass and they're standing like this and they're just waiting for you to walk by and grab onto you. Okay. And so if you can kind of put that, especially towards the bottom of you, you can put it all over, but it's going to be better closer to the ground. So knees and below, hips and below, because that's where you're going to most likely come in contact, and you want that scent strong there. Okay. But other ones, clove is a big one, right? Lemongrass, tea tree, peppermint, lavender, on guard, citronella, those different things like that you can all start to use. So if you don't have TerraShield, you can make your own little concoction. If you have any of those, they're gonna be good. You can also, there's these little devices. These can help. I think it's better than nothing, but nothing's 100%. So don't just put this on your dog and be like, okay, they're perfectly safe. Is it going to help? Is it better than nothing? Yes. They're very cheap, so maybe just do it because an extra layer of protection, but don't rely solely on these. Um, Always, whenever you go outside, if there is a chance, you're going through nature, you're going for a hike, whatever it is, check yourself after each time. We say it constantly, right? Check for ticks, check for ticks, check for ticks every time we come back inside. Check behind the knees, legs, groin, waist, belly button, armpits, ears, hair. They're going to try to get in those places. I got bit in the back of the knee last weekend. Okay. So I'm doing a bunch of stuff to help with that. Don't have a bullseye rash. Don't have anything. Haven't had any symptoms, but I'm on top of it. I got bit. I'm like, okay, I'm going to go after this. I'm going to go after this hard just in case, right? Get to it quickly, go after it strong, and then go from there. So if you do get bit, you want to remove the tick, okay? Highly recommend tweezers because you want to make sure to get that head. If it's buried itself and you just pull and the head's still in there, it can still just keep releasing Lyme, okay? It can be in their saliva. And then if you don't get that out, again, maybe that's the time, right? You catch it right away. It's not the 4 hours yet. It didn't actually transmit yet, but you leave the head in there. Now the head's in there for 3 more days. Boom, now you can get it. If you do, keep the tick, okay? Because you might fail a Lyme test, blood test, but if you keep the tick, there's companies that can test the tick and test it for Lyme, and that can be confirmatory too. So always keep the Lyme, put it between a little piece of tape, throw it in a plastic bag, put it in the freezer or wherever, somewhere that you're going to remember it and it's nobody else is going to get to it. And then if we need to, we can always get the tick tested. Okay. Again, you need proper testing. So this is our testing order, right? We test for Lyme in 2 different ways. We test all these co-infections that come with it, just to see like, okay, we want to make sure we're getting a complete picture of what is going on. And then we get our results, right? Here's a Lyme test, Lyme test that showed up positive. Okay. So I've seen it many times in my clinic. I've run the positive tests. But here's one. This is, they updated what it looks like. This is the same test, but they got negative, negative, negative for Lyme. So they did not contract Lyme potentially, but they did come back positive for Bartonella hensley, so cat scratch fever, right? If they just went to the doctor and saw this, nope, you don't have Lyme. Have a good day. But they missed this part of it. Well, that's exactly what happened. He came to me 8 months later and he's like, dude, like, I'm sick. I don't feel good. Something's going on. I got bit by a tick, but I tested negative for Lyme. I'm like, well, that might not be true still. Let's run a test because now it's gotten 8 months to spread. Well, wasn't Lyme, but was this. So now we could create a plan to start to get on top of this better. Okay. So you want that complete and proper testing. So you do get bit, you do get a bullseye rash. This is one of those few times that I would maybe say antibiotics might be appropriate. I don't like antibiotics. I think they're heavily overused. Are there times and places for everything? Yes. I don't give them out, right? So I'm saying if it were me, this is what I would do. Okay. But this is one of the few times I might actually go down that route. And again, it's best in the first 7 days. This turned into a bullseye rash on the back of my knee. I would have went and gotten some doxy. Okay. I would have went to the doctor and gotten some just to make sure. And the reason I say that is it can get bad. I've seen the worst. And again, if it isn't properly treated, it can get bad and chronic down the road. So I can rebuild a body after taking antibiotics because I know how to, right? So I can rebuild, but if the house burns to the ground, it's hard to rebuild it after that. So again, within the first 7 days, so if you see a bullseye rash, I would consider going to the doctor, trying to get some antibiotics. Okay. Once you do that, give me a call. Then we can start our part of the process. We can do some natural things in tandem and create a plan to say, okay, now here's how we're going to rebuild after all of this. But what they typically do is here's all the research that we found. The standard protocol is doxycycline. Okay. If you get Lyme or you have the symptoms, the doctors are going to give you doxycycline. That's the only thing. Okay. That's their standard protocol. It has been shown to kill 90% of the active Lyme. Great. Okay, we're killing that active Lyme. But as you see over here, it's not able to kill the round bodies. So that encysted form, it doesn't kill any. So if some are in that encysted form, they don't get killed. But it also promotes to double the round body count. So some of the active are threatened by this and turn into round bodies. So it's doubling your round body count and it doesn't kill them. This is how we have recurring, okay? And this is why we don't see a complete treatment, because you take doxycycline, it kills some of the active turns into the defense mode part of it. They sit dormant. Well, you feel better because the active Lyme is killed, but now it's just a matter of time before those inactive ones reactivate. And now your Lyme is back, okay? And now they're starting to say, well, once you get Lyme, you just always have Lyme. It's just going to be a thing, right? Well, yes, if this is all you do, correct. But there's other things. I mean, they show amoxicillin kills round bodies. Other antibiotics kill round bodies. The research has actually shown that doxy and tinidazole are the best combo, but that's not the standard protocol. They can't do that. I literally had like no doctors, and they're like, I could lose my license if I give you that. I'm just like, that doesn't make any sense to me. I can show you the research, but they can't do it. So that's where you need natural things to do that. So what can you do naturally? You got to focus on the foundation. The foundation is important. If you don't have this, again, keeping yourself strong, this is the Arnold Schwarzenegger part of things, right? Keep yourself strong as you can. And this is the best place to start. If you're doing nothing else, this is where you need to start. The VMG, okay, this is like your multivitamin, basically, is what I call it. Gives you a little bit of everything, all your vitamins, minerals, nutrients, all those different things for your body to function properly and nourish yourself. The E omegas are really good quality fish oils. This is really good for the joints, really good at helping heal, repair them, especially if you do have Lyme. Again, they love to attack joints. So that good, healthy fat is going to help with that. And then TB Restore is the gut microbiome, the body microbiome, right? All of our good, healthy bacteria. This is part of our army, okay? We have a good, healthy microbiome. It's going to help defend against any disease, whether it's Lyme, cold, flu, whatever it may be. So this is going to be your foundation. Now, past this, especially, I would say, especially in a situation where you do get Lyme, but just in general, keeping a strong immune system is really important, okay? Your immune system is the number one thing, especially to defend against diseases like Lyme and different things like that. So things like DDR prime, okay? Things like On Guard. These are all going to be great to help support your immune system, keep your immune system strong so that they can do their job. Green tea is great. It's in a lot of doTERRA products. Those omegas, so just like the E omega plus, vitamin D, melatonin, probiotics. So again, I listed several of these in the page before. Oh, here we don't, right? So that's the old LLV, but now we got the new LLV. Here's the probiotics. They come in a couple different forms. This one's really good. The best is actually to take both because they have different microbes in each of them. You're going to get a more complete picture and nourishment of your body of these good bacteria, because this one's going to have a bunch of good bacteria. This one's going to have a bunch of good different bacteria in them. So realistically, you want to take both, okay? I love this one too because this one's really easy to give to kids. Tell them, here's your pixie stick. You got to keep them from taking more and more and more, okay? So I know some kids just, they can't take pills. It's really hard to do it, especially with the Restore. It's hard to like break them open. Like some capsules and things, I could say, well, you can break them open and put the powder in food. You can't necessarily do that with these, but at least if they're taking this, they're getting something, okay? And it's like candy to them. So we've all tried them probably. They taste good. So what are some other natural things? This is more on the antimicrobial side. So this is more of the, I'm trying to attack Lyme, right? Japanese knotweed has been shown to slow down the replication process. So when it splits and one becomes two and two becomes four, it helps slow that down. It's also that antimicrobial to help kill it. Cat's claw is something that they've shown. It's one of the few that can actually penetrate into that joint capsule and into the tissue in the joint to start to kill it from there. We have things like oregano oil that we can start to use, black walnut, wormwood, bearbrain. All of these have been shown in research. Something like GX Assist has the oregano oil in it. It also has things like clove, which can work. So there's a number of good things. Now, GX Assist, we can definitely use. I use with a lot of my patients in this, but again, this isn't the only thing I would use. Again, we would need to make a whole kind of plan based on what this looks like. But that GX Assist does have some of these things in there. That's why when we take it to help clear out, right, a cleansing formula can help cleanse out some of those bad guys. Again, whether it's Lyme or other things like that. Again, we see that oregano oil. One thing I'm doing right now too is I have a oregano oil roller, okay? And I'm putting it around the area that I had that bite, okay? Because it's going to soak in and it's going to start to kill off, if there is any Lyme or anything else, it's going to start to kill it off right in that area directly. I'm also taking some, okay? Internally, attacking from the inside out and the outside in. I'm not letting it get to me, okay? So there's that oregano oil. I do it as a roller, but then I also put some in water and I drink it. Okay, so I'm taking it from the inside out and the outside in. Here's the research to show it. I'm not just throwing stuff up here. Well, it's been shown to do this and this and that. Here's the research. Japanese knotweed, cat's claw, wormwood, skullcap. It keeps going, keeps black walnut. So many different good things that can start to help work. Okay, what are some biofilm busters? We have oregano oil again, we have turmeric, we have garlic, we have cinnamon, right? There's a lot of different things. So we can start to see some of these different things that we can start to use to start to do that. Honestly, with infections, oregano oil is great. It's really strong. It's been shown to work a lot better than antibiotics. And since it's natural, okay, it's not going to have as many negative side effects. It's not going to take out as many good guys with it as like doxycycline would, okay, because it's natural. Your body's going to take it and be like, oh, I know what this is, and then it's going to kind of do its job, okay? And oregano oil, if you take it in a strong enough dose, it really works. It really, really does. I've had people take multiple rounds of antibiotics for like pneumonia, like 3-4 rounds of antibiotics. I'm like, take some oregano oil, and poof, pneumonia is gone, okay? It's that strong. You can use it in that way, but you got to take enough. It's not, here's a drop, right? You got to take quite a bit of it. So again, that's where seeking a professional to help you with this and help make a plan is the important part. Okay. Something to consider too, and this can be part of the diagnosis really, because again, since that it's so hard to, if you fail tests, it's something called a Herxheimer reaction. So this can be used as a confirmatory marker as well, that when you kill off Lyme, it actually releases a toxin. Okay, this is called die-off or the Herxheimer reaction. So this is one of those situations where things can get worse before they get better. It releases a toxin, you makes you sick, or you have inflammation, or you have pain, or you have a headache, that means it's working. Okay. So, and this can affect the treatment drastically. For example, my mom, she was so infected with Lyme. Lyme was so prevalent all over her body that if they just heavy dosed her with antibiotics, it would have killed her. It would have killed off so much Lyme simultaneously that it would have released so much toxins that it would have killed her, right? So she actually had to go on a 2-year antibiotic process where they just gave her very low doses, gave her a little bit, gave her a little bit, and slowly over time they increased it. Okay. Until the last like 2 months, she went in daily to the hospital to get an IV drip strong antibiotic just to make sure it got into all the cracks and the crevices. Okay. So again, we can start to see some of this, but it can be confirmatory, right? If you failed that test and okay, I'm taking some oregano oil, I'm taking some different things, and I get these Herx reactions from taking that. And Lyme is not the only thing. I see that with Candida. I see that with other infections. This isn't the only thing that does this. That means something's there and we're killing it off and we're doing the right thing. It's not fun, right? Sometimes we don't want to have diarrhea and headaches, but I'd rather get it out of your body than to keep it in there. Okay. So we can start to see these things. What else can you do, right? What we can do too is, again, keeping yourself strong is your diet's going to be one of the biggest things. One, just your diet in general to keep yourself healthy, but especially in a situation where we're dealing with Lyme, sugar suppresses your immune system. So, especially when you're trying to keep your immune system strong and you're fighting something, especially Lyme, going on the keto side of things is going to be a big benefit because you're not eating the sugar. Sugar feeds a lot of stuff. When you have Candida, when you have Lyme, when you have bacterial infections, they literally thrive on sugar. So not only are you pouring fuel on the fire, but you're also weakening your immune system with it. Again, the sugar suppresses your immune system. So going keto can really accelerate this process all around. Mediterranean is a great example of that. We're nuts, seeds, fish, vegetables, different things like that. The most common inflammatory foods that I see affect this are things like gluten, dairy. Well, we just talked about sugar, but being very highly processed. It's also a lot of carbs and sugar. So that being part of it, dairy also very processed, also inflammatory, and is going to do very similar to the same thing. Again, we wanted to have a good collagen support, especially if we had Lyme, right? So we've had Lyme, we're trying to heal, repair. Again, if the kitchen's burnt down, you got to rebuild it. So if it attacked your joints and you have joint pain and different things, you need the material to start to rebuild that back up, okay? So that collagen support, things like bone broth, collagen protein, okay? Our Meta Power is going to be great. You can see, right, collagen right there. Don't have it in this box, but right, the collagen's in there. So this is going to be great to help rebuild those joints, the brain, the gut, leaky gut, even your skin, all those different things. Everything connected in your body is held together with that collagen. Okay. All right. I know that was a lot, right? A lot of information, but again, what is our approach, right? Are we just going after the invader? That's all we're doing. We're just trying to put out the fire. That's not wrong. I want to do that. But also, what are you doing for yourself? Are you rebuilding? Are you keeping yourself strong in the meantime, right? So that if you get into a situation, you have a better chance going into it, right? It's always the people that aren't and they get just bombarded, right? They already have preconditions, they already have other things going on, they maybe don't take care of themselves, they don't eat the best. You're at a weaker state so that if something like this happens, it's going to be harder for you. So trying to keep yourself strong is going to be the best thing possible. Okay. So there's different ways that you can get a hold of us. You can get a hold of Sandy too. Sandy's always calling me and be like, hey, I'm sending these people your way, right? But you can get a hold of us. We have Instagram, we have Facebook. You can email us. You can go to our website. We're on Facebook, everything. So you can get a hold of me. You can get a hold of our clinic. If you do have questions, if this is something what you're dealing with Lyme previously, maybe you don't get diagnosed, but you think you had it. I know some people just were on here saying, yeah, I know a couple people that just got bit. Well, let's at least have a conversation, right? Make a game plan moving forward, because again, I would rather get to it sooner rather than later. Okay. And for joining today, typically for a new patient exam, we're going to do a consultation. We're going to do an exam. I'll go through any previous labs that you do. So if you do have lab work, if you do have anything going on that you got from other people, gladly look at that. I'm just trying to gather as much information in this first consult so that we can make a plan of attack moving forward. If we need additional testing, if we need additional labs to fill in gaps, if there's things that are missing, right? That's going to be part of our plan. If there's, supplements we need to do, again, we're going to formulate a complete plan for everything that we need. Typically, this exam is going to run $375, but for joining tonight, it's going to be $99. Okay. So again, get a hold of me, call the office, tell them you joined this call, and then we can get that going. I can see patients anywhere. Okay. I think I need I saw a lady from Alaska. I think that would complete my 50 states. So I'm not saying you have to become a patient, but I believe I have patients in the other 49 states. I think Alaska is the one that I'm missing. So, but I can take care of you guys anywhere. Anything that you need, I can ship right to your house. If you need the testing, I send you a kit. If it's a blood draw, I find a place local to you to get it filled. We get those results. We jump on the phone. We talk through that. We make a plan. Anything you need, I ship right to your door. Okay. Or I help you find locally. Okay. So I know it's hard to find good help sometimes. People are everywhere. I mean, if you look at the Wellness Way map, they're everywhere. But a lot of us have specialties, right? I'm passionate about Lyme. I'm passionate about mold. I'm passionate about men's health. But there's people that, right? My wife is passionate about women, children, pregnancy, and fertility, things like that. So if you have questions or any concerns, just reach out.
Dr. Shane, before you go on, I put your phone number in there to the office, correct? 530-4080.
Yep.
Another thing is Dr. Shane and Dr. Courtney at the Wellness Way and Osseo have been using, and they also are working with folks regards to doTERRA. So that's absolutely huge. And we want to make sure that when you go to somebody and you are taking doTERRA supplements or whatever it might be, that they're familiar with that. And not all, I'm going to tell you right now, not all the offices do. So I think that that's super important to have somebody that understands what you're taking and so on. I'm going to go back here real quick.
These are good questions already.
Okay, so while Dr. Shin's looking at questions, and stay on, we are giving away 15 mil TerraShield tonight, as soon as I'm done wrapping up. So the Facebook group, again, these classes, the classes that other folks in doTERRA offer are also on there. So please join by clicking that QR code or bit.ly/Discover Essentials. The email list, last night's class, tonight's class, will be sent via email. So please join that, bit.ly/email list DE for Discover Essentials. Again, because tonight's class is a continuing ed, make sure that you go to the graduation. Check that first, bit.ly/grad progress 2025. And then continue the class for tonight. Regardless if you graduated or not, make sure that you put this in there. bit.ly/continuing ed 2025 for a free after 10. You can either, we'll talk about that next, I guess. Permanent library, please go out there. There is an abundance of great classes out here. Share with others, get up to date yourself, and really learn about doTERRA. So if you complete your 10, not just 2 essential oils, but think about a doTERRA teachable course. What are these things together aren't anywhere near even $50 for 2. But the fact that you can get a teachable course, that's fantastic. So take advantage of this. Basically, we're compensating you for joining us. And 3 ways to purchase doTERRA: retail, wholesale, and below. We want everyone we care about to get below, and I'm going to show you right now. here is just some of the kits that you can add to your cart and get below wholesale. And this is just a great way. I'm going to go through these here quickly, but again, just look at this one. Here's an awesome one, as well as this right here. We talked about all of these tonight, as well as more. These are ways that if somebody did not get started with doTERRA tonight and wants to, reach out to whoever invited you, and great ways to get them to your home. Please call myself at my phone number is on there. You can text me, call me, or email me if you have any questions. Don't forget doTERRA's wonderful oils, a true gift to the earth. Pursue what's pure. I'm going to stop. We're going to have the drawing. And Dr. Shane,
Recording stopped.
A number between 4 and 67.
4 and 67. I'm going to go with 13.
All right, Kayla will count that up. And did you find some good questions in there?
There are a lot of good questions. Let me make sure. Okay. The first question I see on here is, does a bullseye rash look the same as a ringworm rash? They look very similar, but they are different. A ringworm is going to be usually a single ring, and it's going to be kind of red on the outside, and the inside is going to be, it might just be skin color still, but it might be red. So it's more of like a single ring. That bullseye rash is really going to be kind of layered, okay? And you might see a dark middle, a little bit lighter skin tone area come out a little bit more. So a lot of times, again, they look similar. If you need to, just Google them and literally Google bullseye versus ringworm rash so you can see them next to each other. That might give you a better idea. They look very similar, but they are different. Says, what about peppermint essential oil? They say 1 drop near the body will make it reverse out of you. I'm guessing like if a tick bites you, you put peppermint oil and then they back out is what I think is what they're saying. Yeah, that can work. So give it a shot. A lot of times if they're really attached, there's not a whole lot besides pulling them out that will help. If they're fresh, if they're not quite in there good, that could work. But I mean, it's not going to hurt. Try it. If they don't do it, then pull them out. But I don't always carry a bottle of peppermint with me everywhere I go. So, Wendy, yeah, okay. Yeah, so Wendy's had it. Okay, she has had bullseye rashes. Well, you know how to get a hold of me, Wendy, if you need help. Not every tick carries Lyme, right? Correct. Not every tick has Lyme. So there's not a percentage of what does. So yes, you're correct. Not every tick has Lyme, which is good. I did read Rebecca's while you were going through that. She's talking about she's constantly out in the woods. She's constantly has ticks on her, has quite a few frequent bites. There's no way that she could go to the doctor every time. I agree, right? If you ever get a bullseye rash, that's when I would consider it. But in the meantime, I would be taking some of those things, right? I'd be keeping your immune system strong, taking the On Guard, taking some of that DDR prime, using some of the frankincense, using some of that oregano around that area. Maybe taking that oregano oil, clove, some of those things for a couple days around that bite. Again, if you're getting bit every week, just kind of keep taking it. Now, oregano oil is strong, so that's not something that I'm like, yeah, just take every day as a general health and wellness kind of thing. I wouldn't do that, but if you get bit, I would take it for a few days for sure. Put it around that area again, frankincense, oregano oil, little roller, do that. But if you ever get that bullseye rash, that's when I would consider going in. Terra Shield works really well. Yep, love the Terra Shield. What if we've had Lyme untreated for years? We need to do something. So give me a call. Okay. We can work on it. We can do it. We just have to come up with a plan, whether that's in combination. The hard thing is, unless we get a confirmatory test For the Lyme, we might not be able to do the antibiotic part of it, but there's definitely some natural things that we can start to do. And again, it just depends on the situation and what's going on. But again, some of those natural things like the oregano oil and different things like that are going to work. Depending on how progressed it is, you probably need more than that. So, and again, rebuilding and keeping your immune system. If you've had it for a long time, there may be a chance that you're dealing with some autoimmune, different things. Maybe you get sick all the time, or maybe you don't get sick ever. And that could be a sign that your immune system is weakened or suppressed. So keeping your immune system strong and rebuilding that is going to be a big part of it. Amazing. I had a tick bite me, and I think the next day my VMG arrived. Right? Just poof, here's what you need. So perfect. I like it. Yep. So put oregano on it right away and frankincense too. How many drops do you like to put in your water and how much water? Like what I've been doing is I've been doing like 4 drops in my water. I think I just kind of eyeball. I just put a little bit in there and just kind of take it like a shot. But I put like 4 drops in my water morning and night right now. And I'm doing that for a week. That's over what they recommend, but they're normal. They're what doTERRA puts on their recommendation is it's a standard of what is what's the right way to say it? That is like a maintenance type dose. Okay. There's a difference between a maintenance dose and a therapeutic dose, right? doTERRA is not allowed to put a therapeutic dose on there because realistically, any of us can go on there and buy oregano oil and it says, oh, take 4 drops twice a day. Well, if you don't know what you're doing, you could do that forever and you can really mess stuff up if you do it to that extent, right? So that's where it's like, they don't tell you that, but that's where having somebody that knows what they're doing, we can up that for a period of time to be a therapeutic dose and then come back down and then come off of it and possibly take something else. Hopefully that makes sense. Yeah, oregano is a superpower. Yep. Would homemade sourdough bread help or hinder Lyme? Um, I like that it's homemade. Depending on how you make it, again, like gluten and wheat, typically, I I don't like it. It's going to be carbs and sugar, so it's going to suppress your immune system and also kind of feed that Lyme. Gluten and wheat is just so highly processed here in America too that a lot of times you're just getting a lot of junk with it. So it has to be really good quality. But again, that comes down to in the end, it's still carbohydrates and it's still sugar. So that's not going to help if you have an active Lyme infection. Does dairy include all types or just cow? Are goat and sheep milk or A2 dairy also inflammatory and weaken the immune system? Great question. Okay. Now, if you can get organic, raw A2 milk, different story. Okay. Unprocessed, lots of probiotics in it. But, right, we know you can't just buy that off the shelf. Okay. That's good stuff and is not going to weaken your immune system. Now, goats and sheep milk are still going to be pasteurized, but it's not as highly processed as something like cow's milk nowadays. Okay, because cow's milk is pasteurized. Most often it's high heat pasteurized, so it's trying to kill the bad bacteria, but it also kills all the good bacteria with it. So now you kill all the probiotics, and then they also what they do homogenize it. So basically just shake it so much that it like blows up the fat molecules inside that. And then your body has a hard time absorbing it. And so that's where it's like a lot of it is not that you're actually allergic to the milk. It's the way they process it. Your body has a really hard time absorbing and doing something with it, and then it becomes inflammatory. Okay. So mostly cow's milk because they highly process it. Goat and sheep, it's usually just pasteurized, so it's usually better. And again, raw, organic, A2 is going to be good. My son got Lyme from butchering deer that had Lyme. Yep, you can get it that way too. That's unfortunate. So yeah, that's another thing. That's where it's like, that's where you want to make sure you cook things too properly, because if your deer has Lyme, if a rabbit has Lyme, if something, a cow has Lyme, and then you don't properly cook it, you could get it as well. That heat and fire is going to kill Lyme. So again, proper cooking, that's why we cook a lot of food, right? Wonder if our doTERRA Z pack would be beneficial. Could this be taken instead of Doxy? I don't feel comfortable giving the blanket statement to say you could take it instead of Doxy. It would depends on the situation. I don't want to say that like every time, but like in Rebecca's situation where she's constantly getting bitten, yeah, right? Take some of that Z pack. That's a great thing. Then if you get a bullseye rash, if you do something, that's when I might go a little bit more than that. Okay. Yeah, so yeah, if you get sick, it's a great thing. It's better than nothing. So if you're concerned, if you do get bit, if you do come in contact, go ahead and start taking it. But I can't say that it would replace or you could do it instead of an antibiotic. Again, it just depends. There's more. Would freshly milled flour and raw milk. We talked about the raw milk. I guess depends on where and how you're getting the freshly milled flour. Again, it all depends on what kind of flour, what are you putting on it? Is it sprayed with pesticides and herbicides? How is it grown? Is it grown with fertilizer? What is your cow eating, right? Is your cow eating like Roundup ready corn and soybeans and stuff? You don't want that. Where does toxins get stored? Fat. Milk is primarily fat. So if your cow is eating bad stuff, that milk is also not, it's going to have the bad stuff in it, even if it's raw, right? So organic is going to be the key to those things. If you're getting organically grown and freshly milled flour, yes, different story. If you're getting organic A2 raw milk, yes. Just raw milk, no. Okay, right? It comes down to what are you eating, if that makes sense. Yes, yeah, this isn't being recorded, so I can talk about all that. Yeah. Okay. Um, Getting down to the bottom. Okay, yeah. So now yeah. So yeah, they're kind of talking about, as I kind of answered the questions, oregano oil too. You can put that on them, and they can help kind of come back out of you. Back the tick out by unscrewing it, kind of counterclockwise. Yeah, because that tick will kind of won't. So yeah, kind of doing that. This lady carries a tick key with her. Yeah, there's little tools that you can buy to help get them out if you are in contact with them a lot. And again, here in the Midwest, we're coming in contact with them a lot. So I think that looks like it. I made it to the bottom.
Yes. Yep. Remind everyone that tonight's class is recorded and will be available on Discovery Essentials. Please share this with the folks. And on the PowerPoint slides, and again, I put it in the chat, but share Dr. Shane's phone number. Make it real convenient for them to reach out to them. So we're here to help anyone that's not even on the call. But for those that you are, please unmute and share your full appreciation for Dr. Shane, especially he put this together in just a short time. We just asked him a few weeks ago. So